we can start the session. Meanwhile, the students are joining, and still we have got few seconds to start the session. So this is the Target FMGE session 2021. This is the Anatomy MCQ session 6th. Okay. So myself, Dr. Monalisa, and we are targeting the FMG session. So I have got a total of 8 years of teaching experience. I have done my MD Anatomy from Armed Force Medical College, Pune, and this is my referral code and also unlock code. Those who want to be the part of free sessions on the Unacademy platform. So this is the unlock code of ANAT 10. Now, my dear aspirants, I would also like to tell you about the special class features. It's an interactive live sessions where you can attend the session live and you can interact with the top educators of Unacademy platform. Polls are conducted, and in that poll you can participate and among the learners, and you can know your weak areas, and we can have a quick revision of that areas, and you can pay more attention to that particular part. Raise your hand, ask your doubts cleared right when the session is going on. Now, what happens when you start seeing the free session? You can follow the educator, and you will get you can follow the educator on the Unacademy app, and you will get notification regarding all the sessions of the educator and about that free or the plus session. Lecture notes can be downloaded. So what happens after the completion of the session? You can download the PDF notes, and this is a very useful and a very beneficial part of special free class on the Unacademy platform. Anywhere, anytime, read from the top educators of Unacademy platform at your own place and at your own peace of mind. So use just the code ANAT10 and get 10% discount. And also the unlock code. So plus course के बारे में अगर बात करें तो when we are talking about the plus course, all the 19 subject is completed in a very systematic way. The entire course for targeting the examination, whether it is INI-CT, whether it is NEET PG, whether it is NEXT, whether it is FMG. So that is the crux point. Learn from the top educators of Unacademy platform, compete in live tests and quizzes, study on the device of your choice, assess more than 25,000 MCQs. And coming soon is the printed notes which will be provided to you when you take the plus subscription of more than 1 year. So iconic subscription, what are the benefits? The benefits of the plus course is added on along with the benefits of the prep ladder course. So that means you get the benefits of two important platform. Okay, so you get the benefits of two important platform. One is the Unacademy, another is the prep ladder. Okay, so you can be the part of clinical and integrated versions, video lectures from the Dream Team, QBank 3, rapid revision, snapshots, treasure, dream notes. All these can be provided to you, and you can use the code ANAT10 to get 10% discount if you are going for plus subscription, iconic subscription of Unacademy platform. My dear aspirants, I would also like to tell you about the updated, highly effective QBank 3, QBank of more than 25,000 high-yield clinical MCQs on the platform of Unacademy based on the latest pattern of exam. Detailed explanation is given to each and every MCQs. Use the code ANAT10 and get 10% discount. If you want to take the subscription of Unacademy, you can just use this code. I also want to congratulate the toppers of NEET PG aspirants 2021 examination, and I'm very glad to share their images with you. All the best. Now, I would at the end like to compare the NEET PG subscription of Iconic and Plus along with you. You can have a look on the 4 years, 3 years, 2 years subscription, and their rates can be compared, and you can go for the subscription. Use this code ANAT10 and get 10% discount. Yes, so let's start with the session now. We have got 20 MCQs, and let's start the MCQ together. So starting with the first MCQ. All the best to everyone, those who have joined, and do participate in the MCQ session. Which is true regarding the carpus bone? Which of the following is a true statement regarding the carpus bone? Scaphoid articulate proximally with ulna and has got a tubercle. Lunate articulates with the ulna and is broader anteriorly than posteriorly. Triquetrum articulate proximally with the articular disc of distal radioulnar joint, and pisiform lies on the palmar aspect of trapezium, and it is composed of 7 carpal bones. So question number 1, we have got 5 options, and you have to give the right answer. Question number 1, what is the true statement regarding the carpus bone? So we have got 5 options, and mark the correct answer. Question number 1, mark the correct answer. Your time begins now. So all of you, please mark the correct answer. Question number 1, what do you think is the most correct option which is provided here? You have to mark the true statement here. So I got a mixed bundle of answers, but many of the students has given the wrong answer. So what happened? So my dear students, scaphoid is articulating with ulna. No, it is articulating with the radius and scaphoid. Okay, it's not. So this is a wrong statement. Lunate articulates. No, it is also articulating with the radius bone. Then only the wrist joint is formed. Tricutum articulate with the articular disc. So yes, my dear aspirants, option number C is correct. I would like to show you a diagram for this so that your doubt is gone on. So tricutum is the bone which is articulating with the distal radioulnar joint, articular disc. Pisiform on the trapezius is absolutely right. It is sitting on the tricutal bone. It is composed of 7 is absolutely wrong. It is composed of 8 carpal bones. So we have got C as the correct answer. In this option, we have got C as the correct answer. Let me show you. This is the radius bone and this is the ulnar bone. Okay, so my dear aspirants, what you can appreciate that the bones which is articulating, this is the radius bone, and you can see radius bone is articulating with the scaphoid bone. It is also articulating with the lunate bone. So the articulation of lunate and the scaphoid bone, the articulation of scaphoid and lunate bone with the lower end of the radius, which will lead to the formation of wrist joint, which is also called as radiocarpal joint. So now see here, this is the tricutum, and on the tricutum, the bone which is sitting over is the pisiform bone. Okay, and here the tricutum bone and the ulnar bone is separated by the ligament, that is inferior radioulnar joint articular disc. It is separated here, and these are the whole carpal bones which is shown. So actually here we can see the distal and the proximal role of the carpal bone. So these two, try to catch her. Here C stands for scaphoid, then is the lunate, then is the tricutum, and then is the pisiform. Try to catch her. Here's the tri is for trapezium, the other T is for trapezoid, and capitate is catch, and hook of hamate is her. So this is the mnemonic which I think most of you must be knowing it. C looks too pretty, try to catch her. These are the mnemonic for the carpal bones as we are starting from lateral to medial, L to M. Now, the same thing I want to show you in this diagram of X-ray. So you can see here the radius and the ulnar bone. The bone which is articulating with the radius is scaphoid and that of the lunate. The bone which is actually separated from the ulna is the tricutum bone, and here on the top of the tricutum the pisiform is sitting. The distal row is formed by trapezium, trapezoid, capitate, the largest, and then we have got this hooked hamate bone. So these are all the distal row. Now here is another diagram where you can see this is the radiocarpal joint which is formed between the radius and the scaphoid and the lunate. And here you can see this is the distal radioulnar joint and this is the articular disc. Here, this is the articular disc of distal radioulnar joint which is separated from which bone dear? Tricutum. Can you hear? Tricutum bone is separated from the ulna by articular disc of distal radioulnar joint. So we have to choose one as the correct answer. So which will be the correct answer? C. So is it okay, everyone? Have you understood? Give me a thumbs up if you have understood that C is the correct answer. Yes, absolutely right. Okay. So let's move on to the next MCQ. Okay. Which is the best describing the action of pectoralis minor muscle? So we have got 5 options and you have to tell me which of the following is best answer for describing the action of pectoralis minor muscle. Pectoralis minor muscle, which is the best answer? So question number 2, your time starts now. Stabilize the scapula by drawing it inferiorly and anteriorly against the thoracic wall, anchors and depresses the clavicle, adducts and medially rotate the humerus, rotates the scapula and flexes the humerus bone. So your time starts now and mark the correct answer. So we have got 5 options. Question number 2, mark the correct answer. Best action of pectoralis minor muscle. Best action of pectoralis minor muscle. Okay. So yes, if we talk about the best answer or the action of pectoralis minor muscle is, it is stabilizing the scapula by drawing it inferiorly and anteriorly against the thoracic wall. Okay, so the best action of pectoralis minor muscle, which is lying under the cover of pectoralis major muscle. Okay, actually it is arising from the 3rd, 4th and 5th costocartilage junction of the ribs and getting inserted onto the coracoid process. I would like to show you a diagram for it. And the best action of pectoralis minor is stabilizes of the scapula by drawing it inferiorly and anteriorly against the thoracic wall. See here. So very nicely you can see this is the third, this is the fourth, and this is the fifth rib costochondral junction. And what is the insertion point? What is this structure? This is the coracoid process. So this is the whole origin and insertion of the pectoralis minor muscle. If we talk about its action, the most important action is that it stabilizes the scapula by drawing it inferiorly, anteriorly against, and it also raises the rib in the case of inspiration. So this is what is the correct answer for the correct action of pectoralis minor muscle. Question number 2, A is the correct answer. So all of you, let's move on to the next MCQ for today's session. Question number 3, what is the nerve supply of the marked muscle in the image? So you can see the muscle. So this is, you have to identify this muscle and you have to tell me what is the nerve supply of this muscle. Question number 3, whether it is median, ulnar, radial, anterior, intraosseous nerve. So according to you, which is the best answer for this MCQ? We have got 4 options and you have to choose the correct one. So, okay, we have got few of you have given the correct answer, and the correct answer is anterior intraosseous. Which muscle is this? Which muscle is this? Quadrilateral in shape, quadrangular, approximately quadrangular in shape, this muscle. Which muscle is this? Anyone must be knowing. What is the name of the muscle? Pronator quadratus, which is this is the deep muscle of the anterior forearm, pronator quadratus, and it is getting innervation from deep branch of median nerve. So what is the innervation? It is getting innervation from anterior intraosseous nerve. Deep branch of the median nerve, that is anterior intraosseous nerve, is the correct answer. Now see here, if we talk about pronator quadratus muscle, it arises from the lower 1/4 of the anterior surface of the shaft of ulna. So it is arising from the ulna and it is inserting into the radius bone, running transversely and then inserts into the lower 1/4 of the anterior aspect of the radius. What is the nerve supply? The nerve supply is anterior intraosseous nerve, which itself is a branch of median nerve. The action of pronator quadratus muscle is it is causing pronation of forearm. It is causing pronation of forearm at the radioulnar joint and the innervation. So what was asked in the MCQ? The MCQ was about its innervation. So clearly you can see it is getting innervation from anterior intraosseous nerve, branch of median nerve. So we have got pronator quadratus nerve supply is anterior intraosseous nerve. So D is the correct answer. Let's move on to the next MCQ, MCQ number 4. All the best. Identify the histological slide, whether it is fibrocartilage, hyaline cartilage, elastic cartilage, or articular cartilage. So I am thinking tomorrow also 6 and 7:30 p.m. 7:30 p.m. ke session will be of 40 minutes only, 40 to 45 minutes. So tomorrow also I will take 2 sessions of MCQs, 6 p.m. and 7:30 p.m. So all of you can join me. Now please mark the correct answer for question number 4. Your time starts now. Let me explain it nicely. I think I have to go through the explanation now. So actually the correct answer is elastic cartilage. So only I told you revision is very much required, because histological slide, I think many times I have taken a session on histological slide. So let me explain you once more. Actually this is an elastic cartilage. Why? So my dear aspirants, can you see these are all chondrocytes? What are these? These are all chondrocytes. So my dear students, this slide is having so many of chondrocytes. So it is dense chondrocytes are there. That means number of chondrocytes are much more. Number of chondrocytes are much more. And the outermost layer which you are seeing, this is P. What is this P? P for perichondrium. So it's a slide which is having perichondrium. It's a slide which is having a dense aggregation of chondrocytes. Other than that, you can see these are the fibers which is seen. In between there is fibers. Pinkish, highly means taking a good stain, and this elastic fibers. What are these? These are elastic fibers. Sorry. So these are elastic fibers. So a slide which is having elastic fibers, which is having perichondrium, which is having dense aggregation of chondrocytes. All these features are telling us that this is the slide of elastic cartilage. Many of the students has given the hyaline cartilage as the correct answer. My dear aspirants, hyaline cartilage can't be the correct answer, and the reason is that why? Because in case of hyaline cartilage, there will be cell nest. What do you mean by the word cell nest? Means the chondrocyte will be in group like this. See here, the chondrocyte will be lying in a group, and this group is called a cell nest. Okay. Fibrocartilage will be having no perichondrium, no perichondrium. Articular cartilage will have no perichondrium. So we have got C as the correct answer. Let me show you the elastic. Let me show you the images and explain you. Here, this is the slide of the elastic cartilage, which you can see. This is a slide of elastic cartilage where the histological features are quite evident. This is P for perichondrium. This is whole slide stuffed with the chondrocytes. Large number of chondrocytes are there. In between, you can see the elastic fibers are running. In between, you can see many elastic fibers are running. So this slide is having many elastic fibers. So all these are clearly showing this is a slide of elastic cartilage. Now, so please, all of you do revise the identifying features of fibrocartilage. When I'm talking about fibrocartilage, you can see chondrocytes are less in number. Chondrocytes का number क्या है? Less होता है. Can you see here? This is a chondrocyte. This is chondrocyte. This is chondrocyte. The whole slide will have collagen fibers much more, and feathery appearance. The slide will have feathery appearance. So perichondrium is absent. No P. No P means no perichondrium. Few scattered chondrocytes. So I have written the identifying features of the slide. Perichondrium is absent in adult. Intercellular substance has got much number of collagen fibers. Few scattered chondrocytes are there. Now, when we are talking about the costal cartilage, so perichondrium is present. So here P for perichondrium. Perichondrium is present. And my dear aspirants, can you see here? This is the group of chondrocytes. So what is this group called as? Isogenic group. Isogenic group of chondrocyte, or you can say cell nest. इसको क्या बोलते हैं? Cell nest बोलते हैं. So the identifying feature of a slide of hyaline variety or costal variety cartilage is that perichondrium is present. Chondrocytes are much more in number, but it is arranged in group. That group is called as isogenic group, and the whole slide is having a basophilic appearance. So this is all ground glass appearance. So this is all the features of costal cartilage. Elastic cartilage, perichondrium is present. Can you see here? This is brightly pinkish in color, bright pink in color. It is having so much of stuffing. You can see chondrocytes are stuffed together. Chondrocytes are stuffed together. Intercellular substance, elastic fibers, and chondrocytes are there. So, and perichondrium is present. Articular cartilage, you can see it's a very hazy appearance, a part of bone. So actually articular end of the bones is having articular cartilage. So a part of bone is evident. Along with it, no P. No P means no perichondrium, ground appearance, and small dots which you are seeing is the chondrocyte is arranged in oblique vertical group. So such appearance was not there in the histological slide provided. So articular cartilage is also not the correct answer. So the correct answer is elastic cartilage. So is it okay, everyone? Have you understood it? Can we move on to the next MCQ? Give me a thumbs up if you have understood, so that we can move on to question number 5. Thank you. Let's move on to question number 5. Okay, identify the histological slide. Don't worry, if you mark wrong also, I am there to explain. So just identify this slide. Just identify this histological slide. Whether it is spleen, thymus, lymph node, or tonsil, your time starts now. Take your time. I will increase the time to 30 seconds and mark the correct answer. Take your time. I have given 30 seconds so that you can see the slide nicely and then you can give the answer. Please don't be in hurry to give the answer. See the slide nicely. Concentrate on the high points and the histological features and identify points, and then mark the correct answer. That is how you can approach to the right answer. Okay. So yes, 33% students has given the right answer, and the correct answer is thymus. Very good. Those who have given, actually, what is this? So I would like to highlight that this is one, this is the another one. So we have got few of this, and these are Hazel Corpuses. What is this? These are Hazel Corpuses. So a slide which is having Hazel Corpuses You can see here, this is the lobules incomplete. This is the cortex part. This is the medulla part. So in the medulla part, there is pink rounded structure, and these are Hazel corpus. So a slide which is having a Hazel corpuses becomes a slide of thymus. Spleen is not the correct answer because there is no red pulp, white pulp. Lymph node is not the correct answer. Subcapsular sinus or lymph node or aggregation is not there with germinal center. Tonsil will have a lining epithelium of stratified squamous, non-keratinized with lymphatic aggregation. So thymus is the correct answer. Now, my dear aspirants, I would like to show you this histological slide. So this is a slide of thymus. Okay, let me come up. This is the slide of lymph node. So what I want that quickly, I would like to show you the slide of all these histological features so that you will not make a mistake if it is asked in your examination. So see here, let me slightly show you. Here you can see, let me use a green color. So can you see, this is the fibrous capsule. Outermost is the fibrous capsule, and just below fibrous capsule, there is a slight gap here. So what is this gap called as? This gap is called as subcapsular sinus. So what is the identifying feature of lymph node? What I am showing you is the D. Furey's histology slide from the D. Furey's histology book, PDF notes. So from there, I want to explain what are the identifying feature of the lymph node. So in case of the slide of lymph node, you can see in the center, there will be a germinal center. So this is lighter stain. So this is germinal center. And outermost part, as you can see here, outermost part is called as the cortex. So here what happened, this is one lymphatic aggregate, this is another lymphatic aggregate. In the center, there is germinal center, and outermost part mein lymphatic aggregation hota hai. And subcapsular sinus there, this is the medulla part with medullary cords, and this is the key feature of identification of the slide of lymph node. Now the next slide which I want to show you is the spleen. So my dear aspirant, this is what? This is white pulp, this is white pulp, this is white pulp, this is white pulp, this is white pulp. So white pulp ka matlab, it is having germinal center and lymphatic aggregation. So this is germinal center lymphatic nodule. The key feature is in this lymphatic nodule or white pulp, this is the central artery. What is the location of central artery? The location of central artery is eccentric. The location of central artery is eccentric. So the location of central artery is eccentric. Okay, so in this lymphatic aggregation, central artery is eccentric, and there is the red pulp. These are all red pulp and these are all white pulp. Okay, so there is trabeculase. This is the fibrous capsule which you are seeing. This is the fibrous capsule which you are seeing. Okay, this is the fibrous capsule which you are seeing. Okay, and this is the trabeculase which is going inside. Lymphatic aggregations are there. In the center, there is immature lymphocyte which is called as the germinal center. Now, next is the slide of tonsil. What are the key features of tonsil? What I told you, this blue structure which you are seeing here is the lymphatic aggregation, lymphatic nodule. And other than lymphatic nodule, what is the lining epithelium? The lining epithelium is stratified squamous, non-keratinized epithelium. What is the lining epithelium? Stratified squamous, non-keratinized epithelium is there. These are the tonsillar crypts which is seen. So there is tonsillar crypt. There is lymphatic aggregation. Lining epithelium is stratified squamous, non-keratinized epithelium. Lymphatic aggregation is there. All these points will give you a clear hint that this is a slide of tonsil. Now, what I have shown you is the enlarged view of the spleen. So in this high power view, I want to show you the spleen, and what I want to appreciate here. So my dear aspirants, can you see these two structures? What are these? These are the central artery. So this is one lymphatic nodule, and in this lymphatic nodule, which is called as the white pulp of the spleen, the location of central artery is eccentric. So the key point for identification of the slide of spleen is white pulp having eccentric location of central artery. So lymph node identifying features is it is having thin capsule, it is having subcapsular sinus, lymphatic aggregates, and medullary cords. So these are all lymphatic aggregates, subcapsular sinus. So if you see the slide something like this, this is the slide of lymph node. So all the identifying features, please, all of you download the PDF and revise the identifying feature of histological slide. Lymphatic tissues are very important, lymphatic organ and structure. So revise identifying features. So this is the slide of lymph node. When I'm talking about the spleen, it is having red pulp and white pulp. This is what white pulp, and white pulp, the location of central artery. So here this is the central artery, and central artery is eccentric in position. Central artery is eccentric in position. So this is the identifying feature of the spleen, which is quite appreciated here. This is the slide of thymus. This structures, which is rounded dots in between in the medulla, these are all Hazel Corpuses. So the slide having Hazel Corpuses is the slide of thymus. Incomplete lobules, medulla in the center, and Hazel Corpuses in the medulla. Now, palatine tonsil, most easy to identify. Lymphatic nodules. What is this? Lymphatic nodules. What is this? This is the crypt, tonsillar crypt and depression, lining epithelium, stratified squamous, non-keratinized epithelium. Stratified squamous, non-keratinized epithelium. Let's move on to the next MCQ, MCQ number 6. Identify the histological slide, whether it is appendix slide, whether it is colon, duodenum, and gallbladder. Yes. So by seeing this slide, how you can appreciate, I will give you the key features also. So very nicely you can appreciate, mark the correct answer. Now I am reducing the time to 15 seconds only, because the most important characteristic histological feature is quite evident, and you can clearly mark it right answer. So your time starts now. Okay, answer is colon. So why colon? Let me slightly zoom this diagram. So here, can you see what is this? Let me use. What is this? Which has not taken a proper staining. What is this? Anyone, what is this? This is the hint. So this is the characteristic feature for identification. What is this? Goblet cells. So a slide having many goblet cells. A slide having many, please don't get disheartened that you are not marking it correct. So nothing to worry, I am there to explain. So a slide having many goblet cells. So here you can see the slide is full of goblet cells. So always when you see the slide of colon, the most important identification feature is that is lining epithelium. As you can see, these are the nucleus and this is the simple columnar epithelium only. But the most characteristic feature which is giving you the hint of identification is goblet cell. So slide having many goblet cells is the colon. Appendix नहीं होगा, lumen नहीं है. Okay? Duodenum में Brunner's gland होता है, villi भी ज़्यादा prominent, which is not. Gallbladder में no submucosa glands and all, and brush border epithelium that is not there. So we will go with colon, which is having many goblet cells. So B is the correct answer. See here, this is the slide of colon. So can you appreciate the goblet cells here? Everyone, can you appreciate the slide is full of these structure? What is this? This is the goblet cells, and the same thing was given in the MCQ. So this whole is full of goblet cells. So you can see here, absorptive columnar epithelium, mucosa, and lamina propria, many goblet cells are there, which is the most important characteristic feature for the identification of colon. Other than that, when you see the slide of duodenum, the most important identifying feature is Brunner's gland. So Brunner's gland is there, duodenal gland in the Brunner's gland. So other name of duodenal gland is Brunner's gland. Is the slide which is showing villi. So you can see villi, microvilli. And other than that, the submucosa. Which layer is this? This is the submucosa layer, which is full of Brunner's gland. And this is the characteristic features for duodenum. In case of ileum, why ileum is not the correct answer? Because ileum, जब आप देखोगे तो वहां पे बहुत सारे villi हैं. And in case of histological slide of the ileum, you can see so many lymphatic aggregation. What is called as, it is called as Pierce patches. So when you see the slide which is full of lymphatic aggregations with germinal center, this is the with villi. Villi का मतलब villi होगा mucosa, submucosa, muscularis layer, all the layers of GI tract along with Pierce patches. This is the characteristic feature for identification of ileum. So this becomes a slide of ileum. When you see the slide of appendix, a beautiful lumen is seen. Okay, lining epithelium is columnar epithelium only, muscularis, mucosa, and so many lymphatic. So a beautiful lumen is there with many lymphatic aggregations are there, and simple columnar epithelium is the lining, and lumen is seen and lymphatic aggregation is seen. So this is the most important hint which is showing other than all the layers will be similar to the GI tract, but a slide which is having lymphatic nodule, lumen, lining epithelium, columnar epithelium. That is the slide of appendix. See here, all the layers of appendix has been shown from inside to outside. Mucosa, submucosa, muscularis, and serosa is there. Lumen is seen, and lymphatic aggregation. What is this? These are all lymphatic aggregation with germinal center. So this is a slide of appendix. Got it? Let's move on to the next MCQ, everyone. Okay. So before that, gallbladder. So see here, when you see a slide of gallbladder, simple columnar epithelium with brush border. What do you mean by the word brush border? Irregular arrangement of the microvilli. Lamina propria, there is no submucosa layer. No submucosa layer. So submucosa layer is not there. Muscularis mucosa, submucosa not there. Only the muscular external layer is there. Honeycomb, irregular appearance. So this is the key feature for identification of gallbladder. So quickly I have done with this histology thing. Those who want to go through histology in much detail, they can attend my histology session. Don't worry. So all of you, let's move on to question number 7. 20 MCQs are there. Carpal tunnel does not contain which of the following? Which of the following structure is absent in carpal tunnel? Your time starts now. Mark the correct answer. Easy one. Okay, 67% students are correct. And ulnar nerve, absolutely right. Ulnar nerve is passing superficial to transverse carpal ligament. It is not a content of carpal tunnel. So yes, ulnar nerve is the correct answer. It is not forming the content. So rest all the option which is mentioned here, medial nerve, the tendons of flexor digitorum superficialis, the tendon of flexor digitorum profundus, and tendon of flexor pollicis long. All these are the content of carpal tunnel. Absolutely right, but not the ulnar nerve, because ulnar nerve is passing superficial to flexor retiniculum. So see here. So this is a diagram, very beautiful diagram, which is showing the content. So you can see here, the median nerve is the most important content of the carpal tunnel. Along with it, tendons of flexor digitorum superficialis and profundus is there. Median nerve, tendon of flexor pollicis longus is there. So flexor carpi radialis, which is shown here, exactly passing between the gap of the flexor retiniculum or transverse carpal ligament. And here you can see both ulnar nerve and ulnar artery, along with palmaris longus and palmar cutaneous branch of ulnar nerve and median nerve. All these structures are passing above flexor retiniculum. So ulnar nerve is the correct answer, not passing below flexor retiniculum. Let's move on to question number 8, which is not a content of the axilla. Which of the following structure is not a content of axilla? Axillary, blood vessels, lymph node, trunks and divisions of the brachial plexus, axillary nerve and lymph node. So your time starts now. Mark the correct answer. 5 options are there and you have to give the correct answer. Question number 8. So yes, few students has given the right answer. Manish has given the right answer. Trunk and brachial division. My dear students, trunk is content of neck. Division is lying behind the clavicle. Division is lying behind the clavicle. So actually, cords of brachial plexus is the content of axilla. Cords of brachial plexus is the content of axilla. All other options are absolutely the content of axilla. That is axillary blood vessels, lymph node, axillary nerve, and lymph node. Okay, lymph nodes, 2 options are there. Sorry. So C is absolutely wrong option. Why? Because trunks and division of brachial plexus are the content of neck and line. Neck में trunk होता है और clavicle के behind divisions of brachial plexus lie करता है. Okay. So all of you see, this is a transverse section where the content of axilla has been shown. The content of axilla is axillary vein, axillary artery, cords of brachial plexus, and the long thoracic nerve, intercostobrachial nerve, lymph node, and fat. Now, question number 9. Nerve supply of submandibular gland is, which of the following is the nerve supply of submandibular gland? Whether it is auriculotemporal nerve, lingual nerve, glossopharyngeal nerve, inferior alveolar nerve. Four options are there. Mark the correct answer. Question number 9. Four options. Mark the correct answer. Okay. So yes, 40% students has marked it right. The correct answer is lingual nerve. So actually lingual nerve is giving innervation both to submandibular gland and that of sublingual gland. See here, I have shared this pathway, sympathetic and parasympathetic pathway. sorry, sympathetic and parasympathetic pathway for the innervation of submandibular gland. So the preganglionic parasympathetic fibers arises from superior salivary nucleus, then passes via nervus intermedius, facial nerve, coda tympanic nerve, lingual nerve. Then it relays in the submandibular ganglion. From here, postganglionic fibers arises and it is giving innervation to submandibular gland. So here lingual nerve is the correct answer. Same way, if we see the sympathetic one, it is arising from the plexus around facial artery and passes via submandibular ganglion and supplies submandibular gland. So see here, superior salivary nucleus say parasympathetic fibers arises via facial nerve, coda tympanic nerve, and give innervation via lingual nerve to that of submandibular gland and that of sublingual gland. So we have got the correct answer here, B. Lingual nerve is the correct answer. Question number 9, lingual nerve is the correct answer. Let's move on to the next, that is question number 10. Which nerve passes through marked foramen in the image? So can you see this black arrow foramen, this one? So you have to tell me which of the following nerve is passing through it. Lingual, mandibular, coda tympanic, inferior alveolar nerve. Your time starts now. Okay, so the correct answer is inferior alveolar nerve. Okay, correct answer is inferior alveolar nerve. Absolutely right. So see here, this is showing the mandibular foramen on the medial aspect of the surface from where in which the inferior alveolar nerve is traversing through mandibular foramen and then passing through mandibular canal, as you can see here. And then the nerve which is emerging out, as you can see here, is the mental nerve and the incisive branch. So these are the branches. So which is the correct answer? Inferior alveolar nerve is the correct answer. So yes, let's move on to question number 11. Nerve supply of arrow marked area which is shown in the diagram. Nerve supply of arrow marked area shown in the diagram. Ulnar nerve, radial nerve, medial nerve, axillary nerve. Your time starts now. Okay, all of you have marked it correct answer. The medial nerve is absolutely correct answer. Absolutely right. Actually, nail birds on the lateral half of the finger, lateral 3.5 finger on the dorsal aspect is getting innervation from medial nerve. So these are all areas of medial nerve. This is whole area of R for radial nerve on the dorsal aspect, and this is the area of U for ulnar nerve. On the palmar aspect, you can see this is the area of innervation of medial nerve, radial nerve, and ulnar nerve. So this is a beautiful diagram which is describing the cutaneous innervation of the areas of innervation on the dorsal and the palmar aspect of the hand. Let's move on to the next. Question number 12. Which of the following is not a boundary of yellow color highlighted triangular space? Which of the following is not a boundary for the yellow color highlighted triangular space? Gallbladder, cystic duct, common hepatic duct, and cystic artery. Four options are there. Mark the correct answer. Question number 12. Yes, absolutely right. So yes, the correct answer is cystic duct. Cystic duct is actually not forming any kind of boundary for the yellow color highlighted triangular space. Yeah, gallbladder, sorry, gallbladder. A is the correct answer. So actually the boundaries of Callott's triangle. So the yellow color triangular space is Callott's triangle. The boundary is 3C. What do you mean by the word 3C? 3C means its boundary is by cystic duct, its boundary is by common hepatic duct and cystic artery. Got it? So we have got this as the common hepatic duct. This is the cystic duct. And we have got this as the cystic artery superiorly. So these three structures is forming the boundary of Callott's triangle, not the gallbladder. So here also the same thing. The yellow color area is the Callott's triangle. Actually, hepatocystic triangular space. इसमें अगर boundary पूछा गया, अगर question hepato cystic triangle का है, then the superior boundary is by inferior border of the liver, but not for the Callott's triangle. Callott's triangle boundary is by cystic duct. Okay, the common hepatic duct and that of the cystic artery. And that of the cystic artery. This one. This is the cystic artery. Cystic artery. Now, arrow-marked area in this image is giving innervation to which dermatobal contribution? Your time starts now. Your time starts. Whether it is T9, T10, T11, and T12, your time starts now. Absolutely right. So here, yes, absolutely right. We have got T10 is the correct dermatomal contribution. Actually, the area around the umbilical region, the area along the umbilical region is getting innervation from the dermatomal contribution of T10. Arrow marked area in this given image, dermatomal contribution is by a T10. Now, my dear students, you can just enlarge this diagram, download the PDF, and can revise all the dermatomal contribution of dorsal, anterior, means ventral aspect and lateral aspect of the entire body. You can have an idea of the contribution or the cutaneous innervation of the entire body by seeing this diagram. Now, question number 14. All statements considering gluteus medius and minimus are correct except. Which of the following statement is the wrong statement about gluteus medius and minimus? Have got the same nerve supply, got the same action, supplied by the same blood vessels, abducts the thigh, rotated laterally, responsible for preventing sagging of unsupported side of the pelvis during walking. So there's 5 options and you have to mark the correct answer. Question number 14. Okay, the correct answer is abduct the thigh and rotate it laterally. Absolutely wrong. Actually, it is rotating. Anyone who want to answer, it is rotating medially. It is rotating medially. So all statement considering gluteus medius and minimus are correct except, so D option is wrong. All other options are right. Same nerve supply, superior gluteal nerve, same action of the muscle. So yes, abducts and medially rotation, same blood supply. Gluteal arteries, superior gluteal arteries, and it is preventing the unsupported side of the pelvis when you stand on one leg. And this is done by this is the primary action of gluteus medius and minimus, which is also, if the nerve is injured, superior gluteal nerve, the unsupported side of the pelvis will sag down if you stand on one leg, and that sign is called as, anyone, that sign is called as Trendelenburg sign. Now, identify the type of fibers marked in the image. So, can you see this arrow marked area, this one? So, you just tell me which type of fibers, what fibers are this? Long association fibers, short association fibers, commissural fibers, or projection fibers. Your time starts now. 4 options are there. Mark the correct answer. So yes, many students are there, but they are not participating in the poll. So I always tell whether it is right or wrong, you can participate. Okay, so 40% students are correct. So projection fibers. So D option is absolutely right. What is the structure? This is actually internal capsule. The structure marked here is the internal capsule. Can you see here? This is the internal capsule which you are seeing. This structure is internal capsule, and so we know that internal capsule is a type of projection fibers. So see here, this was asked in your MCQ to identify the type of fibers, and clearly you can see this is internal capsule, this is the anterior limb, this is the bend, this is the genu, and this is the posterior limb of internal capsule. Exactly, it is residing between thalamus and that of caudate nucleus medially, and laterally the structure line is the lentiform nucleus. So internal capsule is a type of projection fibers which is exactly passing between two important structure, lentiform nucleus, L for lentiform nucleus and L for laterally, and we have got thalamus and caudate nucleus medially. So see here we can clearly see this is the internal capsule fibers. Now here I want to show you actually commissural fiber. So actually internal capsule is connecting the area. So see here, this is internal capsule, this is an example of projection fibers because this is connecting cortex area with the subcortical area. What do you mean by commissural fibers? So projection fibers का मतलब होता है it is connecting cortex area to that of the lower area, cortical area. When I am talking about the word commissural fibers, it is connecting right hemisphere, right cerebral hemisphere with that left cerebral hemisphere. Green color. This is corpus callosum. Association fibers बहुत छोटे छोटे fibers हो गए which is not crossing from one cerebral hemisphere. It is connecting adjacent area of same cerebral hemisphere. Means right half of the brain के adjacent area को connect करने वाले fibers को association fibers बोलते हैं. So that was an example of internal capsule is an example of projection fibers. See here, this is the association fibers. What you are seeing in the diagram is association fibers. You can see here the superior longitudinal fasciculus, cingulum, uncinate fasciculus, inferior longitudinal fibers. All these fibers which is shown in this diagram are example of association fibers connecting the areas of one hemisphere only, one cerebral hemisphere, not crossing the adjacent cerebral hemisphere. This is a diagram which is showing inferior view of corpus callosum. So why corpus callosum is an example of commissural fibers? Because corpus callosum is connecting the two right and the left cerebral hemisphere. It is connecting right hemisphere with the left cerebral hemisphere. So this is an example of commissural fibers. Let's move on to the next. What is the nerve supply of marked structure in the given image? So you have to identify that muscle and you have to tell me the nerve supply. Your time starts now. Okay. So what is this muscle? This is lumbrical muscle. Okay. Okay. This is lumbrical muscle. Which muscle is this? This is lumbrical muscle. See here. This is lumbrical muscle. So all the students, those who have joined, tomorrow also I will take anatomy MCQ session, and what I am feeling that revision of anatomy MCQ is absolutely required for you because many mistakes are coming up. So median nerve is the right answer. This is first and second lumbrical. This is first and this is absolutely right, Pankaj. This is first, this is second, and this is third and fourth lumbrical. So you can clearly see the third and fourth lumbricals are bipinnate. You can identify by this. And the first, second are unipinnate. So what is the nerve supply of first and second? Median nerve. So median nerve is the correct answer. Okay, if the question was about third and fourth, then it was of ulnar nerve. So here, these are the first and second lumbricals. So the answer is median nerve. Tendon. So this is easy. Tendon of bicep femoris and neck of fibula is used as a guide for location of which of the following nerve? Options are saphenous nerve, sural, common fibular, medial plantar or tibial nerve. Your time starts now. We have got 5 options and you have to mark the correct answer. Okay, so yes, we have got 40% of the students. Common fibular nerve is common peroneal, common fibular nerve is absolutely right. So I would like to show you this diagram. Can you see here? This is the fibula bone. Okay, this is tibia, T for tibia, and this is the fibula bone. So fibula, F-I-B-U-L-A, fibula bone. So here you can see common peroneal nerve is winding around just below head, around the neck. Around the neck of fibula, the nerve which is winding around laterally is the common peroneal nerve. Now, which muscle tendon is commonly removed for grafting without causing much of disability? So, if this nerve has been used, if this nerve is commonly used for grafting, there is not much of difficulty. So, whether it is extensor hallucis brevis, fibularis tertius, plantaris, flexor digitorum brevis, tendon of flexor digitorum longus. So, according to you, which is the correct answer? Question number 18. Your time begins now. Mark the correct answer. Okay, so the correct answer here is plantaris muscle. Actually, it is a degenerating muscle. Plantaris muscle is a degenerating muscle. So if it is degenerating, there is not much of difficulty if this has been removed and used for grafting. So C is the correct answer. See here, can you see here this plantaris muscle is shown from the posterior view of the lower limb leg, and you can see it is very tendon. It is just like a tendon and very thin muscle, which is not of much of functional activity. If it is removed also, not much of difficulty occurs. So this is commonly used for, this is the muscle which is commonly removed for grafting without causing any kind of instability. So I would like to tell you about plantaris muscle in detail. So plantaris muscle originates from lateral supracondylar ridge of the femur above the lateral head of gastrocnemius. Insertion, so actually plantaris muscle is also inserted into the calcaneum bone, actually tendocalcaneus. Okay, together with the gastrocnemius, the plantaris muscle is inserted. Sural artery is the arterial supply. Action is plantar flexes the foot and flexes the knee. Nerve supply is anterior ami of S1 and S2. So please note down, if the whole of plantaris muscle is cutted, dissected out, or has been taken out, not much of difficulty is sacrificed. So we can go for this. Commonly, we can use this muscle or the tendon for grafting. Okay. So yes, tomorrow also I will continue with the MCQ session. All of you do join, because many of the MCQs revision is required. Many wrong answers are also coming up. So that is important. Superior end of vagina surrounds. Superior end of vagina is surrounded by. Means it surrounds, means it's surrounded by. I mean to tell surrounded by. Is surrounded by. Okay. Round ligament, urogenital hiatus, urethra, cervix, neck of bladder. So according to you, which is the correct answer? Superior end of vagina. Vagina is surrounded by which structure? Very easy. Mark the correct answer. No, superior end of vagina surrounds which structure? Yes, surrounds. Easy one only. It surrounds which structure? Superior end of vagina is surrounds. Okay, my dear aspirants, if you remember the word, actually cervix is the correct answer. Actually, if there is cervix, it is whole surrounded by the part of vagina. So अगर ये cervix है तो vagina का part इसको whole surround कर रहा है. The part of vagina which is surrounding its anteriorly is anterior fornix. So that part is called as fornix of the vagina. The part surrounding the cervix laterally is lateral fornix, and the part of vagina surrounding the cervix posteriorly is the posterior fornix. See this diagram. This is the cervix, and you can see vagina is surrounding the opening of the cervix, and this part is like this. So you can see it's a fornix-like structure. Whole of this is surrounding the cervix in the form of fornices, in the form of fornix. Got it, everyone? Okay, so let's move on to the next MCQ. Which muscle is the larger part and the most important muscle in the pelvic floor? Which muscle is the larger part and the most important muscle in the pelvic floor? Whether it is coccygeus, whether it is obturator internus, piriformis, deep transverse Perini muscle or Levatorani muscle? Question number 20th. Mark the correct answer. Your time begins now. Okay, so yes, we have got Manish Kumar is leading, followed by Aisha, Dr. Gaurav, Shweta, Soumya, Saf, Pankaj. Great. So Levatorani is the correct answer. Actually, Levatorani is the muscle which is forming larger part and the most important part for the pelvic floor muscle. So Levatorani is the correct answer. Levatorani is the correct answer. Okay, so actually Levatorani along with the coccygeus, these two muscles is forming the pelvic floor. But if we talk about the most important and the major contribution which is forming the pelvic floor is the Levatorani muscle. So see here you can see actually the whole Levatorani is a big bulky muscle of the pelvic diaphragm. It's again having different parts. It is having iliococcygeus, pubococcygeus and puborectalis, pubovaginalis part. All these are the parts of Levatorani muscle. Along with Levatorani muscle, we have other muscle that is coccygeus posteriorly. These two muscles, coccygeus posteriorly, these two muscles together forms the pelvic diaphragm, which is giving support to the pelvic organ, So yes, E is the correct answer. So all of you, please, so tomorrow I am taking two sessions, one at 6 p.m. that will be of 1 hour, then 7:30 p.m. that will be of 40 minutes to 45 minutes. Okay, 45 minutes, 40 minutes or 55 minutes something. So two sessions again, that is anatomy MCQ revision session. So it is not that it will be useful only for the FMG aspirants. It will be useful for INICT NEET PG aspirants. So all of you do join, because what I am feeling that few days I have given a gap. I have not taken the session. So anatomy MCQs is requiring a revision, and let's in a week, either 4 to 5 days, I will take special free sessions. All of you do present live so that we can solve as much as anatomy revision of MCQs. So that would be required for everyone. All the best, keep studying, and thank you so much. Any doubt or is it okay? Let me know. So students who are joining for the first time, they have to download the Unacademy app, and then they have to use the code ANAT10 for unlocking free sessions on the Unacademy app. So not only this, if the students wants to take the subscription of Unacademy, they can use my code ANAT10 and get 10% discount. So interested students should use this code ANAT10 and get 10% discount for the subscription of Unacademy. So do present for the free special session, which I am targeting the students for their competitive exam, because in November we have got INICT, 12th December we have got FMG 2021 examination. So let's crack it together. So okay, any doubt, let me know, or can I end the session? Let me know. So tomorrow also two sessions will be there, 6 p.m. and 7:30 p.m. Tomorrow 6 p.m. and 7:30 p.m. session. So two sessions I will take. So do join, that will be helpful for you. All the best, keep studying. Thank you so much. We will again meet up with the new session. So all anatomy MCQs, special sessions, we will solve the anatomy MCQs most important. So let's start with firstly the one-liners and the basic one. Then we will also come up with the cadaveric image sessions and the clinical MCQ session. So YouTube also, I will take the session. So mixed bundle of sessions, few on YouTube and few on the special free platform. So what is the benefit of free platform? You can also have the PDF notes. So all the best, keep studying, and let's meet exactly tomorrow for the two sessions, 6 p.m. and 7:30 p.m. All the best. Keep studying. Thank you. All of you can download the PDF and revise all the histological slide and everything which I have taught today. So all of you, please do download this PDF notes. That would be extremely beneficial for you. Thank you.